Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister.
Morning.
Okay, so let's jump right into it today. So it's been some time since we spoke about the Liliendahl Center for Infectious Disease Control. We know there were some final minor works that were to be done. Can you tell us about how the facility has been functioning at the moment, and is it now capable of operating at full capacity?
Well, despite those minor works, which is things that we're continuously fixing, various little things that pop up, the hospital itself has been functioning for some time now. We do have capacity probably for about 150 or more patients. There is a section of the hospital that remains to be fixed, and we'll do that maybe in the next couple of months. We'll look at that section. But we have adequate space for those patients that we have. Currently, we have about 10 patients that are in there, 4 of whom are in the ICU. And as you know, we have capacity there for 25 persons in the ICU. So we have adequate space for patients who require hospitalization.
Okay, so now let's talk a little bit about the Diamond Smart Hospital. I know works were ongoing there, and they should have been completed by December. Can you give us a little bit of an update on that?
Well, actually, the contractor had a year to finish the project, but they have worked very quickly, and they've done very good work. And they were telling us that they could have handed over by December. Unfortunately, because of some of the items they required to bring from overseas, those were delayed a bit. But our expectations are by the end of this month, we'll be able to have a handing over of the facility. And so we can return the Diamond Hospital to full operation. There are most of the internal works in the building itself, they have completed those. There are bits of external work that they have to do, and I'm very confident by the end of the month we'll be able to get it back.
Okay, Minister, still on smart hospitals, I know work would have commenced at the Lenora facility just recently. Do we have any update on how the construction works have been going so far?
Well, how they've scheduled the works, they're starting from the outside and then going in. And so they started doing some of those types of works, like on the pharmacy and so forth, and then they will go into the building per se. But they've had some challenges with the rainy season, and so I think they've done some rescheduling of what they're going to be doing first and second and so forth. But nevertheless, I think things are progressing. Services at the Lenora facility continues at the site, and at some point when we have to do more of the internal works, we'll have to deploy some of these services to the nearby community. So we're not going to disrupt the services, we're just going to put it in another area so that people can still access health services. We have, as you know, 3 other smart hospitals that we're working on. The contract for Mabaruma has been issued. However, the contract has not started as yet, and that's something that we are hoping that it will start shortly. We also have a smart hospital in Lethem. The contractor started last year, so they're working on that, and they're making substantial progress. And the 5th area is at Paramakotoi, and that contract is going to be done in collaboration with the Guyana Defense Force. So that is going to start this year. So when we complete these facilities, they are going to be more efficient in terms of energy utilization of water and a whole host of other things. The flow of patients would be done in a much more efficient manner. And basically, they'll be more climate resilient, which is what we are ultimately aiming for. As part of this project as well, we have done an assessment of about 86 other facilities. And we are going to use that blueprint of how to improve the facility to make it more climate resilient and more energy efficient and so forth as we do repairs and we upgrade some of our other health centers.
Minister, you said that works for the Lenora Hospital, they would have had to been rescheduled because of the delays in the weather and some of the materials, and so, well, the materials would have been for Diamond, but do we have a specific timeline when the Lenora Smart Hospital is supposed to be completed by?
All these projects, the contractors have been given a year, but that's being extra cautious, the amount of time that they have on the contract. We are confident and in the discussions with the contractors that they can complete much earlier, and therefore they still have enough time to be able to finish what they're doing. In terms of Lenora, while initially they would have scheduled a number of works to be done externally, they have now, because of the weather, decided to put that on a hold and do more internal works. So it's not like nothing is happening. They're still doing works, but they're now concentrating on areas where they can work because of the weather.
Okay, thank you for that, Minister. Now, turning our attention to communities and regional health officers and the role they play in these communities. Can you outline the role of a regional health officer in the context of regional health services being provided by the Ministry of Health?
Well, a regional health officer really is the person who is responsible for health services in that particular region. And they do so from a clinical standpoint and from an administrative standpoint. So they function in both roles. In most regions, you would have hospitals, you would have health centers. In some cases, you have health posts. So all the infrastructure relating to health falls under this person, and then they report upwards to the department here in the ministry that deals with regional health services. So there is that, hierarchy, if you like. Our health system, the lowest round would be at the level of health posts. Then you have a health center, district hospital, regional hospital, and then a national referral hospital. In most regions, you have health posts, health center, district hospital, regional hospital. And then if they can't deal with the cases there, then they refer them to the national hospital. So this has been how we've been working. And the network of facilities that we have in these regions, we have been constantly striving to improve them. We have mapped out at each level of the service what types of services we can offer, what level of personnel we need to offer those services, and we strive to provide that year long. So it is, these regional officers are the ones who would have to ensure that these services are provided. They have wide-ranging responsibility.
Okay, Minister. Now let's turn our attention to the education sector. We've spoken at length about the reopening of schools and for senior students, but what about those younger ones? Do you have any advice for parents of students? I mean, they're in online classes, but can you advise them on the appropriate age to start wearing masks? Or, well, I guess everybody has to wear masks, but you know, what they can do to protect their children. I mean, they wouldn't have to be going out for school, but I mean, they would have to go sometime or the other. Do you have any advice for them?
Well, I mean, basically they're at home. Those children who are not in the classes that are returning to school, so they're at home. What we have to ensure is that we develop a schedule at home so that learning is not lost. We would have lost almost a year already, and if this continues, then there would be a substantial deficit in the child's education. So you need to, as parents and as guardians, you need to get whatever the curriculum is, and the ministry has published these things. They have published a lot of resource material, workbooks, worksheets, and you need to ensure that that child is learning at home and following the curriculum. If they do so, then they would not have substantial learning loss. But if that does not happen, then you'll have a significant problem, because to make up for this year that they would have lost, it would be, you would have to put in a lot more work. There's also, the ministry has also, through their network of teachers, have been also giving guidance in terms of online classes. And they do have the Learning Channel that would put out a number of, well, I think they have schedules of which classes are coming on when and so forth. And while we had one channel, that has now been increased, so there are about 4 channels that depending on your age group and so forth, you can tune into. So that's how we're trying to address the online schooling. But this really depends on the efforts that parents and guardians would make to ensure that children are learning. Now, because they're in the home environment, we don't think it would be that threatening. However, if these children are going to be going out into the community, running around the place, and not taking precautions, they can get infected. So they need to also take precaution when they leave the home. And just like everybody else, those same 3 things that we have been advising people to do, wash your hands, watch your distance, wear a mask, also applies to children. The WHO did put out some guidance relating to children, and they recommend from 5 years and above that children wear masks. And the only reason why they didn't recommend it for lower age is because the child can easily be pulling and tugging on the mask, and that's the reason why. So if the child is mature enough and can understand the rationale for wearing the mask, then sure, you can go ahead and do that. But not having the mask, children are not really exempt, because everybody, the transmission occurs the same way for everybody. It happens for children as well. So if you wear the mask, it's going to be protective, but because of the younger ages, you want to make sure that they do not wear the mask appropriately and can have breathing difficulties. And that's why the WHO recommendation is from 5 years and above.
Thank you for that, Minister. Now, before we go, schools reopened on Monday, and there would have been testing exercises ongoing in the regions as dorm students return. Do you have any updates for us, as in the numbers of how many students have tested positive so far?
Well, we have not completed the exercise, but so far in almost every region where there are dorms, we have been testing both students that are returning and the staff that would be working in these dorms and schools. And in all the regions so far, we have found positive staff members and students. But when we complete the exercise, we'll probably be able to give you a more comprehensive view of what is happening. But right now, this exercise is ongoing. A number of those samples have been sent out to the labs, so they're currently being processed, and we'll get a better picture perhaps in another 2 days or so.
Thank you very much for that, Minister. This has been our COVID-19 update. For more information, visit our website dpi.gov.gy or our social media platforms.